Good afternoon. My name is Ray Kuhl. I'm CEO of PBSI Technology Solutions. I want to welcome each of you to today's webinar. We're going to discuss phone system advances applied to patient satisfaction. How can we evaluate the way a patient interacts with our practice, and what impact can we have, positive or negative, by the setup of our phone system and our voicemail? The goal, we want to help. Today the goal is to communicate useful information, to educate and inform. The purpose of today is not to sell products and services. I want to thank the Academy of Medicine in Cincinnati, a longstanding partner of PBSI's, for co-sponsoring this educational webinar series. So welcome. Our agenda today will be short and focused on important information. So we're going to talk about what are some of the mistakes and frustrations that we see related to patients and other folks who interact with our practice because of our phone systems and our design of our voicemail. What are appropriate principles to follow in designing voicemail? What are the goals that we have for our voicemail system, or should they be, in a modern healthcare practice? Some specific issues about daytime and nighttime call routing, and some of the other optional details that can be very useful on hold, music, and messaging. So again, my name is Ray Kuhl. I'm joined today by my friend and colleague Colin Ashley, who is a PBSI telecommunications specialist. Glad you've joined us. So I want to thank many of you who've been long-term PBSI clients. You've been clients in some cases for many years. Your long-standing support is much appreciated and acknowledged. For some of you, this is your first exposure to PBSI, so I want to welcome and thank you for attending. Hope you find today's information valuable. So the things to know about PBSI: why are we speaking today? From the experience we've gained over many years of serving hundreds of healthcare clients in Ohio, Kentucky, and Indiana. And I'm very blessed, the CEO, to be able to say we have a large and very experienced staff. Among our staff, 22 of our group have been with PBSI for 10 years or more, and I know that knowledge helps clients, and our goal is to help clients succeed. So, purpose of today's webinar: what problems are we trying to solve? Some of the things that we've seen when we ask practices, what are the most difficult problems you face that you'd like to solve with your phone system? Top of the list for many is after-hours callers, the frustration, delay, the perception of a patient that they receive slow communication back once they've made a call after hours to a practice. Too many rings before the phone is answered, callers that get put on hold immediately or indefinitely too frequently, dead air while I'm on hold when something more productive might be useful, or I don't know if I've been put into outer space, or is somebody really waiting. Auto-attendant messages that are too long, too complex, and confusing that begin building frustration as we listen to these long messages and think, why do I have to listen to all this? I just want to talk to somebody. Auto-attendants that are not correctly programmed, resulting in dead air where someone may be sent, in fact, to outer space and have to hang up and call back. Risk, which many practices fear, of voicemail boxes that go nowhere, are never listened to, never monitored, and no one knows whether that's the case. On-call providers, another key issue with many practices. On-call providers losing confidentiality because returning a call results in either no caller ID or revealing the mobile phone number of the on-call provider, both of which are not as satisfactory as they might be. And the bottom line, or a bottom line, practice is saying, I don't like this practice. Just from dealing with the phone system, my initial impression before I've even made connection is, I don't like this practice. I don't like this practice. So, solution: we step back and we evaluate our voicemail as the gateway to our practice. So I'm going to turn over events to my colleague, Colin Ashley, who has focused expertise on this topic. Colin, welcome.
Thank you, Ray. Okay, just moving on to the next slide. Ray, could you move us on to the next slide? While you're doing that, I will kickstart my portion of the presentation. Excellent, thank you very much. First off, much of what I share here will be self-explanatory, and you probably already have in place. But I'm hoping that you may hear one or two insights that will help you refine the way you manage calls and improve patient experience and retention. In fact, for many callers, this may be their very first interaction with your practice. And as the saying goes, you never get a second chance to make that first impression. Of course, we also need to look at phone system setup from the perspective of the practice and its staff. What we can do to help improve staff efficiency, protect their privacy, reduce potential frustrations, while also keeping costs to a minimum. A good place to start is to review your current call management processes. What is working well? What can be improved? Speak to your staff and your patients to get their feedback. This should also extend to dialing into your own office and listen to the auto attendant and checking through the menus to raise earlier point, making sure that you don't inadvertently find that you're sending some of your clients or patients to outer space. Once you've completed this audit, the next step is to design the menu structure of your auto attendant. A good starting point for this is to establish which are the most important calls and highest frequency calls. This information will help guide you when establishing the order of the menu on your auto attendant. For example, the most frequent type of call may be to schedule an appointment. You'll probably want this option as the first choice in the menu rather than have it further down the list. Try and keep your menu down to no more than about half a dozen items, and then use sub-menus where necessary. Once you're happy with the menu structure, the next step is to record the auto attendant greeting, including the prompts. Best practice is to keep this to around 15 to 20 seconds, and to give some thought to who will record the greeting and will give the most positive impression for your practice. If you want a very cool English accent, then feed me with tea and cookies, and I'm your man. Again, think everything through from the caller's point of view. If they're confused, then they may just dial 0. I think we've all done this for reception, instead of being routed directly to the correct person or department. So moving on to the next slide. There we go. Here we see a typical sequence of an auto attendant menu. To schedule or change an appointment, press 1. To speak with a nurse or obtain lab results, press 2. For prescription refills, 3. For billing inquiries, 4. For more information, 5. Or if you know your party's extension, then that would be 6. Let's say the caller presses 5. They then access a submenu. For practice hours, press 1. Directions, press 2, etc., etc. At the foot of this slide, this is a really helpful point. Rather than give out the same practice number to everyone, consider taking one or more of your telephone numbers and giving that to the doctor's offices and hospitals. So let's say another practice calls with a patient referral. Rather than having to access the same auto attendant menu as your patients, they can access another auto attendant created specifically for them. For example, thank you for calling ABC Practice. If you are calling to refer a patient, press 1. For all other calls, press 2, etc., etc. By the way, we will have a Q&A time at the end of this presentation, so do make a note of any questions you have along the route, and we'll address those at the end. So we've discussed daytime handling of incoming calls. Of course, you may also want to create a different greeting and menu for nighttime after-alls call routing. This is often a big frustration for patients. Many practices employ a traditional answering service to handle out-of-office calls and relay messages to staff at the practice. But this is far from ideal. The patient feels disconnected from their trusted provider because they don't recognize the person they're speaking with, nor does that person have much insight into the practice. There can sometimes be a delay in messages reaching the correct person. The provider frequently loses context of details provided by the patient. Also, the physician on call is not able to hear the tonality of the person speaking who gave the message, which may give insight as to the urgency of the matter. And of course, then there's the cost of the service. Depending on the capabilities of your phone system, you may be able to use the voicemail technology built right into your phone system as a solution to these issues. For example, the auto attendant could include a prompt to dial a physician on call. The call can then be automatically routed to both the physician's desk phone and his or her cell phone at exactly the same time. If the call goes to voicemail, then the voicemail can reside on their desk phone as normal, and also an email is automatically sent to their cell phone with a WAV file attached to it containing the voicemail audio. The voicemail can then be listened to and, if necessary, forwarded to a colleague in an email. One of the challenges of a physician working remotely is when they have to call a patient. If they call from a cell phone, then the patient may see their caller ID and risk having that patient calling them any time, day or night, which if anybody has seen What About Bob, they can completely relate to that, the nightmare of that scenario. One option they have would be is to block their caller ID, but if they do that, then the patient will get a private or blocked caller ID notification, and oftentimes that call will not actually make it through. It'll be immediately be blocked, and the physician is unable to speak to that patient. Fortunately, more modern phone systems now give the physician the option to easily call the patient with their main practice number showing, not their cell phone number, which completely alleviates this problem. And of course, it certainly helps that using your voicemail technology also eliminates the traditional answering service monthly fees. It's all incorporated as part of your phone system. There may be some, by the way, licensing requirements, but typically they're one-off charges and they're fairly inexpensive. Okay, final slide here. In this brief presentation, we've covered the best practices behind creating an effective auto-attendant greeting and menu. This is helping you efficiently manage your incoming calls. You may also want to consider taking it up an extra notch by mixing music with your customized messages that your callers hear during hold or transfer. There are services such as one here in Cincinnati that we typically recommend called Killer Spots. They can help you create a customized professional on-hold greeting for you. It all helps create that professional first impression that the callers hear. Okay, that concludes this portion of the presentation. I'll stay to answer any questions at the end, and I'll now hand back over to Ray.
Colin, thank you very much. I value the information and insight. So in summary, hopefully you found this information useful. Voicemail can help you, it can hurt you. The proper implementation of voicemail can have a significant impact on patient retention, on even early first call patient retention, referring source enthusiasm. So if a referring provider knows that they are efficiently taken care of and their patients are apparently efficiently taken care of, the next referral will come much more easily. So if you'd like more information about this, we're happy to do a free evaluation for anyone, particularly Academy members. We have a special relationship where we offer discounted, in some cases, free services for Academy members. But it can help that have somebody from the outside can look at your voicemail with a fresh perspective to make recommendations without obligation or cost. So if you'd like information, feel free to let us know. So again, thank you for your attendance. In summary, we're happy to do free voicemail evaluations. We also do free internet and dial tone evaluations to help make sure you have the latest bundling from Spectrum or Cincinnati Bell or Windstream, whichever carrier is the most likely for you. And we do other things that help with medical offices, video surveillance systems, waiting room, audio and video, sound and overhead paging, security services. So on any of these topics, you're welcome to engage us. But I want to say thank you for your attendance. We're finished with webinar content, and I want to just suggest everybody have a good day, and thank you for your attendance.